Thank you, Madam Speaker. I thank the gentleman for yielding. I commend him for his extraordinary leadership on this subject. I have not been able to watch the entire debate because I was involved in meetings, but I hope that it was made known to all who are following this debate how historic this is that we have Mr. Dingell as part of the management of this bill and bringing this bill to the floor. He comes from a strong tradition of access to affordable, reliable health care for all Americans. His father had it as his life's work in the Congress. Mr. Dingell was a young congressman at the time he sat and presided. He sat in the chair and presided and gavelled the passage of the Medicare bill. I don't know if that has been discussed here today, but I want to be sure that all who follow the record of Congress know of the long history, the family tradition, and the tremendous leadership that Mr. Dingell has provided in this regard. I also want to commend Mr. Pallone from the Energy and Commerce Committee for his important work in this legislation. Mr. Stark, the chair of the Committee of Jurisdiction and Ways and Means Committee, thank you, Mr. Stark, for your leadership, and I also commend Mr. Rangel for the important work that he did to make this vote possible today. People across America saw us pass this bill before the 4th of July break, and it was celebrated by seniors who were concerned and people with disabilities who were concerned about the impact of this reform, modest, however modest, reform of Medicare. After the break, the Senate took up the bill once again. They failed it with 59 votes the first time. You need 60 in the Senate, as you know. And the whole country was jubilant and applauded when Senator Kennedy came to the floor. A fighter for America's seniors, a fighter for people with disabilities, a fighter for our children, a fighter for working families in America. And he left his own physical challenge behind to come to the floor of the Senate all the way from Massachusetts to be the 60th vote. It was such an historic moment, and 9 Republican senators changed their votes on the strength of Senator Kennedy's vote. It was 59 until he voted, and then it became, he made the 60th, and then it became 69, and it was pretty exciting. And people cheered, and everyone was tear-filled and happy that this happened. Affordable, reliable health care for America's seniors and those with disabilities passed. And then the president said that he would veto the bill. He would veto the bill. It was such a downer. So here we are again today to come back to have an overwhelming bipartisan support in Congress of the United States, in the House of Representatives, to say to the American people, we understand the challenges they face. All of the seniors organizations and disabilities groups, of course, support this legislation. But just about every health care providing group in our country supports this legislation as well, except one, and that is some in the health insurance industry. And I guess the president is voting with them and not with America's seniors and those with disabilities when he vetoes the bill. But I am very proud of the work of Mr. Rangel, Mr. Dingell, Mr. Pallone, Mr. Stark. I thank them for their leadership. You have given us an opportunity to vote for the American people, not only as their representatives, but on their behalf. And we're all grateful to you for that. I urge a vote to override the veto and yield back the balance of my time. Thank you.
The gentlewoman yields back the balance.